Hi, my name is Dr. Todd Austin, and I would like to welcome you to the Dr. Todd Show. My special guest on the show today for this episode is Dr. Bryan Reid. And Dr. Bryan Reid practices in Edwardsville, Illinois. He is a chiropractor. He is actually one of my clinical nutrition mentors. If I have a tough question regarding one of my patients about nutrition, he's definitely one of the go-to guys that I would be prone to ask a question to, and he's never steered me wrong. I'd like to welcome you to the show,
All right.
Dr. Reid.
Thank you, Dr. Todd.
And today our topic is going to be cholesterol and those evil statin drugs. So we're aware, and hopefully our viewers are aware, that come January 1st of 2014, we're going to have new cholesterol guidelines, and instead of 200 being bad for total cholesterol level, supposedly the new bad is going to be 180. So can you address those new guidelines and how you think that's going to affect the American public?
Right. Well, currently, worldwide, about 40 million people are on statin drugs. And with the new guidelines that came out last month from the American Heart Association and the American College of Cardiology, the new guidelines are probably going to double the use of statin drugs definitely in the United States here. And that's going to have devastating effects on the population because, as you know, side effects of statin drugs are pretty widespread. The complications include things like diabetes, congestive heart failure, cognitive decline, muscle fatigue and weakness, even impotence.
Yeah.
So it's it's some serious stuff. And the fact of the matter is that they really do not provide any health benefit being on a statin drug. And I think, statistically, about 150 people have to be treated with a statin drug before one person can benefit.
Wow.
And other research states that between 1 and 2 out of 100 may receive benefit from a statin drug.
Yeah, so it's pretty bizarre how society just believes that they need statin drugs when research I saw was similar to yours research. It said that one American out of every 100 Americans, so 1% of them actually need or can benefit from a statin, but yet we have at least 25% of all Americans that are on them. So.
Right. Well, I think it's a cash cow that just keeps giving, and it's probably the biggest lie in the history of humanity.
Exactly.
Lipitor alone is the #1 selling drug in the world.
Wow.
So there's a lot of money at stake,
and of course when your statin drug causes you to get diabetes, then you're worth $750,000 to the big pharma and the medical community over the rest of your lifetime. When it causes you to get impotent, then of course then you go ask for your erectile dysfunction.
That's right. So there's a lot of spin-off benefits
TV,
for the pharmaceutical companies.
So it's definitely good money for them.
Right.
So some people come in with their blood work where they got tested, and of course there's the total cholesterol, the LDL, which is people refer to as the lousy cholesterol, bad cholesterol, the HDL, which is referred to as a good cholesterol, or H for happy cholesterol, and then there's also the triglyceride level. So can you kind of touch base on which of those levels you think is the most important, and how you would look at that?
That's kind of meeting the minimum requirements for your lipid blood tests. If any doctor is just doing your total cholesterol, your triglycerides, your HDL, LDL, and of course just your glucose, well, that's really not going to provide enough information to really assess your risk for cardiovascular disease. What I do with patients is I have them do an advanced lipid profile or a cardio ion test, which actually analyzes the cholesterol with all their fractions, because cholesterol isn't just HDL, LDL, and your total cholesterol. There's other fractions as well. There's chylomicrons, there's remnant lipoproteins, there's lipoprotein A, there's intermediate dense lipoproteins, and one of the greatest problems or risks is how your liver processes your LDL, your HDL. So somebody could have normal cholesterol, but depending on how their cholesterol is packaged, they could be at greater risk.
Okay.
So you really want to know what your total particle number is and your density of each particle. Because if you have low density lipoprotein, whether it's HDL or LDL, then you are at higher risk. What happens is the smaller the particle will drive damage to the arterial wall, which drives an inflammatory immune reaction, which sets the stage for atherosclerosis. That is how the plaque formation starts. Is that these particles get oxidized by free radicals that are in our blood. Sugar is a huge driver of that free radical attack. So diabetics are at great risk for this inflammation of the arteries. But that's why I do that test, because I want to know what their particle size is and what their density is, because that's going to give me a better overall evaluation for their cardiovascular.
Makes perfect sense. And you do that test in your office, correct?
You can do that test through Quest, through LabCorp. There's other specialty labs out there that will do that.
Just have to know what to ask.
That's right. It's got, for instance, LabCorp, it's called a vertical auto profile lipid test that you can do. And again, there's a lot of information with that one test.
We have Quest in this area. What do they call it?
It may be a vertical auto profile as well. Or just an advanced lipid profile. Your doctor should understand what you're talking about. Okay. But again, if he's just doing the standard, minimum lipid work that's been done for years and years, that's 10 to 15-year-old medicine. That is not where the future of lipid testing is going.
Definitely.
Because it doesn't assess risk.
Yeah.
Now with statin drugs, they've coined cholesterol as the enemy, as the bad guy. The statin drugs do a great job at lowering your cholesterol. There's no question about that.
Yeah.
But statin drugs do not have an effect on some of these other particles that I mentioned. Like, for instance, lipoprotein A, which is probably the most atherogenic type of cholesterol particle in your body. So there's nothing to do there. There's no drug that can control that. The only thing that controls lipoprotein A is niacin. Like a low flush, no flush niacin. Because lipoprotein particles are so tiny, they get oxidized very easily in the blood, and they'll embed themselves in that arterial wall and then initiate that plaque formation. And of course, with plaque formation, we run the risk of developing stroke or coronary artery blockage, heart attack.
Yeah, true. And then the last thing I wanted to address while we're on the subject of stroke is that I've been telling my patients for a few years since I learned this, that basically you get your total cholesterol below about 160 and you're asking to die of a stroke.
Right, your risk of stroke does go up.
Yeah. And then a recent book that I've just read, Grain Brain by Dr. Perlmutter, who is a neurologist, he talks about cognitive ability. So someone that had a total cholesterol of 240 would tend to score much greater on a cognitive test like an IQ test than someone with a total cholesterol down here at 140. So what are your thoughts on that?
Well, I think that ties into what the statin drug is doing in the liver. Not only is it blocking production of your cholesterol, but it's also blocking production of another substance called coenzyme Q10.
Oh, exactly.
And the CoQ10 is responsible for converting food, into usable energy for the cell. And it exists in all of our tissues. It exists in the mitochondria, and it drives energy production.
Yeah.
So if your cells are not able to generate energy and to be able to do the kind of things that they are supposed to do, then you're going to lose function. Now, if it's in the brain, you're going to lose brain function. Cognitive decline, dementia can set in. Just overall inflammation can occur. If it's in your muscles, you get wasting of your muscles. You could have restless leg syndrome, just achiness, no stamina, fatigue going up stairs, for instance.
Wow.
And your heart, it has the greatest concentration of mitochondria in the body. The heart has a high energy demand. It has to pump huge volumes of blood every waking moment of your life.
Yep.
And if you impact the body's ability to produce energy, especially in the heart, then you're going to suffer from things like congestive heart failure and arrhythmias. So it's kind of a paradox that we're taking a statin drug to reduce our risk of developing cardiovascular disease, yet on the other end, it actually can increase our risk for developing other heart complications, such as congestive heart failure.
Wow.
If you look at the data, the actuaries, that ever since statin drugs have come out, the incidence of congestive heart failure has been on the rise. Probably attributed
depleting CoQ10.
Depleting CoQ10.
Now,
and CoQ10 is a very powerful antioxidant within our bodies.
Okay. Well, I appreciate the awesome information, Dr. Reid. Thank you for joining me on the show today.
Happy to be here.
All right, and thank you for watching.
Thank you.